Um, Thanks everyone for joining. I'm going to stop looking at the chat and I'm going to stop looking at who's showing up and I'm going to pay attention to my slides. um, so I'm going to talk about how we can popularize the research that we do and other people in the research community do. And let me give you an outline of the talk so you kind of know what's going to happen. It's kind of broken into three sections. I'm going to do some background and then break for Q&A. And then I'm going to do a tour of the writing process. The background is more overview. And then I'm going to talk about writing, kind of getting a little bit into the nitty gritty as much as one can in half an hour or so. We'll do some more questions. And then I'm going to go through some examples. There'll be some examples in the tour of the writing process too, but I have a bunch more examples at the end. And then we'll do more Q&A. Probably when we get to that third section, the Q&A can kind of be simultaneous. It's actually interactive throughout. I will be asking questions and folks will have to just shout out answers. Maybe I can flip on the chat real quick while I do that, but it's kind of hard for me to watch the chat and talk at the same time. So that's why it's about an hour and a half, because there's sort of these three sections that approximately take half an hour. And I want to start with a story about Gregor Mendel. This is someone that many of you remember from high school or maybe college biology. He's known as the father of modern genetics. He's the one who experimented with pea plants in the 1850s and 60s and discovered how heredity works, at least with pea plants, by looking at characteristics of plants as he kind of interbred one with another. And this was an academic exercise. He was being a scientist. And so he did what all good scientists do, and he presented his work at the equivalent of a conference at that time in 1865. And he published his findings in an academic journal, just like we do today. And that's about all he did. And as a consequence of that, his paper received very little attention. For 35 years, it was cited a whopping 4 times, which even for those days was a pretty minimal citation record. And then in 1900, his contribution was rediscovered. It was actually a groundbreaking work and should have been, widely popularized and publicized at the time it was done. But he just didn't do much to promote it, and few others did either. So it just didn't get known. And I learned about this story in Siddhartha Mukherjee's book, The Gene. He characterizes it as the study that founded modern biology, was buried in the pages of an obscure journal of an obscure scientific society for 35 years. So I like to talk about this story because it's a cautionary tale for all of us, even today. This is what we tend to do. Speaking of academics, and for those of you who plan to be academics or to do research, it's very common for us to do what Mendel did. Publish a paper. Maybe we do a little more, we might work with an institution that might do a press release. If we're super lucky, we get to do some interviews, but that's pretty rare, interviews with the media. And then we just go back to work and more or less forget about the work we've done, and it sits in a journal and gets very little attention. And statistics back this up, the fact that we're not doing such a great job, and we kind of know it. 75% of public health researchers think dissemination to non-research audiences is very important. But even press releases and media interviews are very rare. They usually only happen with like the top papers in the top journals, if the results are very newsy and so forth. Most dissemination that we do is through academic journals and conferences, and we actually know this is pretty poor. And it is. It just doesn't get the job done. A lot of good work doesn't get noticed. And it's pretty easy to see why. There's 2.5 million papers each year in 28,000 legitimate journals. I'm not counting the predatory journals. Basically, nobody's going to see your paper unless it's in a really big journal or it's kind of counterintuitive or really newsy. It's just not going to get much attention. And that's the norm. This pie chart shows of all the papers published in healthcare as of whenever this study was done, it was probably about 10 years ago now, only 0.04% received any media attention. That's that tiny little blue sliver in this pie chart. That's 1 out of 2,500 papers. Now, I think more than 1 out of 2,500 papers in healthcare deserve some attention. I don't think all of them deserve media attention. I think some of them are really for us. Some of them are about methods, some of them are about data. Let's be super honest, some of them aren't that good or noteworthy. That's fine. You know, you can't hit a home run with every paper. That's normal. But I think more than 1 in 2,500 deserves some attention. And I think that because I scan a lot of tables of contents of journals in health services research and health economics. And at a much higher rate, I see articles that I think are worthy of some attention. They are policy relevant. They speak to topics of the day. They're timely. And I'd love to write about them all for lay audiences. I don't have that kind of time, but it's way more than 1 in 2,500. And for many papers, as I said, an institution, whether it's an academic institution or the journal itself, will put out a press release, but that doesn't usually do the job, and I want to explain why. Research products and like reports and research publications, like journal articles, come out in a pretty random order at a random time. When we start doing a research project, we have no idea when the paper is going to come out. We don't even know when we're going to finish writing it. And even when we submit it, we don't know when it's going to come out. Even when we get reviews back, we don't know when it's going to come out. Even when it's accepted for publication, we don't know when it's going to come out. So this timeline, these boxes, different colors, represent the topics of different papers as they come out. Like the gray box on the left might be about Medicaid expansion, and the yellow box might be about rural hospitals, and the orange box might be about cost sharing, and so on. These are just coming out at random times. Then you have the same issues coming up in the public debate at the time they come up. So that gray topic, whatever I said it was, Medicaid expansion, that comes out, might come up in the public debate later, and so forth with the other issues. So one thing we can do, because we know the research literature in our field, is when the issues are in the public debate of interest to policymakers, of interest to journalists, we can go back and resurrect those interesting studies and bring them back to light through writing columns, through posting on blogs, through reaching out to policymakers, through lots of dissemination channels that we may have collectively and individually. And this is really the right way to promote the work we do. And it's not done very much. And so one of the meta messages of my talk is that we could help ourselves a lot more by doing more of that. Not just the press release at the time of the study, but remembering that study. It could be 3 years old, it could be 5 years old, it could be 10 years old. If it is still relevant when the issue comes up, it's worth re-promoting, and maybe not by itself, maybe as a collection of studies in this area. You know, a column in a paper or a blog post or a fact sheet doesn't need to focus on one study. It doesn't even have to be your study. It could just be like, you know, this issue is relevant today. Here's why it's relevant. These are some findings in the research literature. Have some conclusions, that kind of thing. And we'll get into how to write those things later. So this is really the big kind of background message I wanted to provide. And the other thing I want to talk about is there's lots of ways to promote research. And I'm going to mostly talk about writing, and I'm mostly going to talk about writing columns. You can think of newspaper columns, but I want to emphasize it's not the only way. There's many other ways that some of us engage in. If we have channels to policymakers, we should use them. If we know journalists, we should email them, and so forth. I like to think about communication in different ways in a pyramid structure, and that's illustrated here with a specific example. I'm going to talk about cost effectiveness of contraception. Actually, I'm not really going to talk about it. I'm just going to use that as an example. There is a research literature on the cost effectiveness of contraception. It's a bunch of research papers in a bunch of journals that nobody's going to read. And one can read them and one can write a lit review. That is already a service. If that lit review is itself in a journal, it won't get read that much, but you could put it on a blog. In fact, I did this. I worked with a research assistant some years ago, and we found most of the important, if not all the important research literature on this topic. And he wrote a lit review. He actually wrote a PDF version, and then he wrote like a more of a blog length version. And it's pretty dry. It's more accessible than the journal articles because it's not gated, because it uses a little more plain language. It's definitely faster. It's a summary, faster to read. But still, it's maybe not going to grab everybody's attention. So I took that lit review and I wrote a column for the Upshot at the time that issue was in the public discussion, because the Supreme Court had taken some actions on this issue pertaining to whether employers needed to cover contraception. Being a health economist, I looked at it from the point of view of cost effectiveness. There's lots of ways to look at the value of contraception. I'm not claiming cost effectiveness is the best or even the right view, but that's what I was conveying in this column. And the column you can view as a more accessible and kind of even faster paced take of the literature, whereas the lit review was exhaustive. I mean, it listed sort of every paper we could find. The column was much not as exhaustive. It was a much more summary fashion. So if I wanted to make a point, instead of listing the dozen articles that made that point, I would just say, for example, this, for example, that, faster. And crucially, I put it in the policy frame. I explained why this was important today. I gave people a reason to read the column. And I used more accessible language and so forth. So we're kind of going up this pyramid, and think the same information is getting repackaged in a more accessible form and in a more compressed form in a way. You know, a lot of caveats are dropped, a lot of nuances are dropped, and so forth. Of course, you can then, and I'll get to this, I think of this more as marketing once you've written something, kind of promote it through emails or through Twitter or other means. Generally, this is a much more compressed version of the issue, a stylized fact and a link. The emails that I'll talk about later are very brief. These are emails I wrote to journalists. And so it's a pyramid. And a key point I want to make is that you absolutely have to have that foundation. I get questions often when I give talks like this. Oh, are you saying we shouldn't write journal articles anymore because nobody reads them? That's not what I'm saying. We have to write the journal articles. We have to do the science. We have to build the evidence. We have to document it. We have to get it peer reviewed. We need all the caveats and nuances in the journal articles. That's where they belong. We need to recognize very few people are going to read and understand them. So then we need to kind of go up this pyramid and disseminate through various means, ideally all possible ways we can think of. There's not lots of ways in this picture that we could think of, like videos, like podcasts, like direct contact to policymakers, on and on. But ideally, in an ideal world, we're disseminating all important things in all possible ways. In the real world, we don't do that all the time, of course, but the more one does, different ways, the same basic content in different ways, the broader an audience you're going to reach. And the other key point about this is that one can trace back through each email, each tweet, back to the column, back to the literature review, back to the original articles. You can link back all the way through, and provided those articles aren't like behind a paywall, which often they are, but if they're not, anybody can access all of the details. Nothing is hidden. And there's ways to get articles even when they're behind a paywall, even for free. So I get questions like, are you saying, hide all the nuances and so forth? No, I'm saying elevate the things that are most important to people, what's on their mind, but give them access in other ways to all the nuances. And sometimes you do want to bring up caveats and nuances, and we can talk about that later. But it is all here. So I want to go to another person in history, Florence Nightingale, and talk about another story. She's known as the founder of modern nursing, and she did something pretty remarkable, which is why we know about her. She, among the things she became famous for, was fighting infectious disease during the Crimean War. And this is around the time when Mendel was working with his pea plants. Florence Nightingale was caring for British soldiers who were completely decimated by infectious disease in the Crimean War, dysentery, cholera, and other infectious diseases. It was basically, they were living in horrifying and disgusting conditions. Florence Nightingale, and this is before the germ theory of disease, but she had intuition, as did others, but she had the intuition that these conditions were not helping soldiers. They were, if anything, hurting them a great deal. So she lobbied for sanitization efforts, and she got some resources to clean things up in a particular, near the front of this war for the British soldiers. And with her efforts, disease fell. But the British medical establishment disputed the effectiveness of what she did, probably because she was a woman and they were white men. But they just didn't believe that what she did was effective. So she was also known, and I didn't know this till I heard about this story on a podcast that I linked to at the bottom. She did something, she was actually known for doing something pretty remarkable, which was disseminating her findings in ways that were accessible quickly to not just a broad audience, but also the policymakers and sort of the elites she was trying to communicate with. And she took her story of fighting infectious disease and made I guess what we call today an infographic, which I'm going to show you on the next slide. I'm not going to show it to you yet because to our eyes, it actually doesn't look that accessible. But to people at that time, it changed minds because it showed them in a very much more accessible way than they were familiar with what she did during that war in terms of bringing down disease. What people advocated for at the time was, oh, put everything in a table, do the wall of numbers thing. And that's how you move minds. And they were wrong. That's still wrong today. While that's clearly disseminating sort of everything, if you put all your numbers in a big table, it just makes it impossible to see the forest for the trees. So this is her famous rose diagram, and I'm not going to talk through it because it's not my point for us to like totally understand it. But the basic idea is that the big blue wedge things, first on the right-hand side and then on the left-hand side, show the infectious disease sort of rates or proportion of the population that was suffering from them across a year and then into the next year as you go to the diagram on the left. And this showed how, when she implemented what she did, they went down. Many people since that time have said this is actually a pretty poor diagram as diagrams go, but it was way better than how dissemination was done at the time. And so the story here, in contrast to the story about Mendel, is that if you package what you're trying to communicate in a more accessible way, you can move minds and change opinions, and you have a chance. But if you just do what Mendel did, you basically don't. So that is the overview part of this talk. And I'm going to pause for questions. I've put up here some typical questions I get, and I'm happy to answer them, but I won't answer any question that's not asked by someone in the audience. So you can ask one of these questions or any of your own questions. We're going to get to like specific writing details in a moment. But are there any questions or comments about overview, about dissemination in general, anything I mentioned?
Austin, are you going to talk more about reaching out to journalists to try to sell your idea or your paper?
Yeah, yes, I am.
Okay, all right, thank you.
Any other thoughts? Don't be shy, because we have time.
I have a DEIJ question, but I see other people have their hands raised first.
Oh, and I'm sorry, I'm not looking at people, so it's hard for me to pick
I'm
out.
happy to help.
Someone wants to moderate.
Calling. I saw Nicholas, Michelle, and Jacob. So maybe Nicholas first.
Thank you.
Mm-hmm.
Julia, that's too kind. Thank you very much. So this is near and dear to my heart, and especially the title of evidence-based medicine was near and dear to my heart, because the people who don't want to hear evidence-based medicine are the public at large. They don't want to hear that 60 to 70% of their care is not evidence-based and not based on science. So how do you get around that sort of confirmation bias that people look at this and sort of say, geez, I don't want to hear that the care I'm getting is crappy, because it is.
Yeah.
Sorry, I just need to be honest.
Well, I've written that very thing. I mean, I've written that very thing. And, people are by and large not going to hear what they don't want to hear. So, I don't think, I think it's too big a burden for me to think that I'm going to like get to everybody, right? But how do I at least get to the more of the gettable people? And something I will talk about later in the writing detail section is you do need to meet people where they are. I always advocate starting with something that everyone can agree with. Get them sort of on your side in a way, like nodding their head, and then hit them with the thing that might not be what they really think. And that's how I do it. It's hard to measure effectiveness. I don't know how effective that is. But I'll give you some examples of that later. Okay, Michelle has her hand up. I am looking at everyone now, so go ahead, Michelle.
Thanks, Austin. I was wondering how you would pitch to the New York Times or other publications. You've already said that it's in the public discussion. It's a good time to resurrect. Yep. But is there a way, perhaps like other ways to pitch, or even when it is in the public discussion, are there reasons why maybe you choose to promote certain articles and not others, pitch certain ideas or not others? Yeah,
so it's easier to pitch things that are sort of hot, and you kind of know what those are, things that people are talking about. It's actually, but even though it's easier to pitch those things, it's sometimes harder to break in on those things because other people are covering them. And so a news outlet might say, oh, we have too much on that, or no, someone else is already writing a column on that, and so forth. So conversely, you're going to get less competition on things that aren't being discussed, or aren't being discussed in the way or the nuance that you want to get to, or the angle you want to get to. But you have to do a little more convincing to get a place to take it. And so what I like to do, I don't like to chase things that I think are very, very topical, because it's like a saturated environment. So for example, I've written almost nothing. I mean, just like a couple of things that pertain to COVID, because everybody's writing about COVID and has been for a year. Or if there's like a really big report that's just come out, like a CBO report pertaining to health, or like scoring a health bill, or even a really big study, often I won't even try to write about it, unless there's like a nuance that other people aren't getting at, and that can be sexy to a place like Upshot or other places where you say, like, there's an aspect to this that everybody's missing. And if you can convince them that you have like the insight that nobody else is bringing, then they're interested. But what I love to do is actually what I call get people to eat their broccoli, which is try to sell a story on something that nobody's talking about, but they really should, or they are kind of talking about it, but they don't really realize it. So there's some really intriguing research pertaining to this issue, but to get at it, you kind of get under the hood, and I think it's really fun to try to bring those to light. Is that helpful?
Yes, that's helpful.
Any other comments or questions?
I think Jacob had a question and then I had one.
Okay, Jacob.
Yeah, Austin, I love the simple diagram of the different colors of when different papers are published and when the topics are actually relevant, because I think it is such an important insight that the work on dissemination is not just right after your paper is published. And my question is a follow-up on that, which is around, that one. How much time do you allocate to dissemination as opposed to the base of that pyramid? And to what extent should we be, how should we allocate our time? I mean, is there, you've been very effective in both of these things. So I'm curious how you've navigated this yourself, but also as we think about this, are there returns to specialization in the middle versus the bottom of the pyramid, or should researchers really be doing all of this all the time?
Yeah, it's a good question. I think as a community, we don't need everybody doing all of this all of the time. I think specialization is worthwhile. I think some people, and I also think it's impractical to expect everybody can do all of this all the time. Some people just have a passion for certain aspects of this, whether it's certain kinds of research versus certain kinds of dissemination, and some people just don't, and it's very hard. It's almost like just not worth it, in my view, to try to get people who don't have a passion for one aspect of this to do that over something they are passionate about and can be very efficient with. So I think it's more of I view it as a community endeavor and a community priority, that we need some amount of people doing some amount of the translation and dissemination, and we need to reward them for that and acknowledge them for that. And particularly those folks shouldn't just be doing it for their own work. They should be doing it for the community, which is, and I practice what I preach. While I've written about my own work, it's a tiny fraction of all the writing I've done, because I just don't do enough work to write a column every other week in the New York Times. So I think that goes some way to answering at least part of your question. I feel like it was a multi-part question. So is there another part you want to remind me of for me to get to?
I think you answered it. The point you just raised about whether there's a conflict of interest between promoting your own work and being the sort of unbiased translator of the field is also really interesting.
I think there is actually, and I think a good outlet will kind of look askance a bit at self-promotion, and Upshot does. Like, basically they frown on it, and while I've been able to work in some of my own work into pieces that I've written, they caution me, like, it can't be like the feature. It's got to be, you cite this, you cite that, you talk to this person. Oh, and by the way, I have done a little work too, and here, it's not quite a footnote, but it's certainly not the main course. So I think that's totally fair and reasonable. I think basically, in any form, if someone comes at a dissemination activity with an agenda in mind, whether it's self-promotion, whether it's a particular issue promotion, and this is a hot topic of debate I've gotten into, but I do worry about if you come at it with an advocacy mindset, where for whatever reason you bias can creep in very easily, because you have a different agenda other than just explaining the research, right? but many academics do advocate, and there's actually nothing wrong with that. It's just it's a different activity. It's not one that I do, or at least I don't do it principally. It's not what I do. So that's definitely a worthwhile conversation. Although I think we should probably defer it if people want to get into it. Was there another hand up, or Julia, maybe you have it?
Yeah, I had a question. In my experience, we have had the best luck placing op-eds through personal connections. And we've been following COVID policies pretty closely, and I keep seeing the same names appear often in the top newspapers. And I wonder what names aren't appearing. And if the people whose names are appearing bring a different perspective, and if we're systematically missing, particularly people who are underrepresented in academia, and people who are most affected by COVID also. And I wonder if newsrooms, if you've heard them start to have conversations about how to think differently about how they select op-eds and how to pick up on those. We have several student fellows who I really hope we can share their voices broadly, but how would we get the student fellows into the top newspapers?
Yes. Well, I hope, I think newsrooms are thinking about that, and I hope they're trying. I'm happy to help. I work with a bunch of people, and we regularly are trying to get things placed in different places, and we have some contacts and relationships. We can help anybody, certainly the BU community, try to do that. One thing I've tried to do, but I've been a little bit stymied because editors don't always like it, is try to promote others to those editors, either as co-authorship with me or just on their own. But some editors in some places, they really want certain voices, and they want voices that are repeated regularly. They want people who are going to be able to provide content regularly. They have an idea that readers want to hear the same person repeatedly, which I'm not sure I agree with, but they want to form like relationships with people. So it's very sometimes hard for some editors to think about kind of switching and pulling in new voices. I think they're a little afraid of it for that reason. All right, we have two other. Oh, I see two hands up.
Michael and Jacob.
Yeah, let's do those two, and then let's move on. We have two other Q&A opportunities. So.
Yeah, thanks, Austin. So one is sort of, I guess, related to stuff that's been brought up, and you maybe will get to, is sort of pitching things versus just submitting unsolicited. And then my other question was about the green box on your sort of thing, which all your arrows were kind of, you've written something and then something happens later.
Yeah.
What about writing? You're working on something, but the paper hasn't come out yet, right? But the topic is hot now, and sort of sending. Is it worth putting in the time and effort if you're not referencing an actual paper? I guess.
Yeah. Bring up your first question later, because I think I'll have a better. But the second question. So what I advise people is to, because even before our publication comes out, we are experts in our field, right? We've been trained in the field, we've been working in the field, we've written grants in the field and other papers in the field. All those reference the history of literature. One thing I've done many times is gotten multiple uses out of the writing I do. So like, think about a grant you've written and it's got a literature review. Maybe some of that literature review will show up in a subsequent paper, but it's also great to mine for columns and blog posts. If you can connect it to something people want to learn about, it's not your work. Maybe you haven't gotten the grant yet. Maybe you haven't done the work yet. A reason to do it is the same reason to write about your own work, which is you're principally promoting yourself and your institution as having expertise in this area, and you're developing relationships. To the extent journalists notice, they'll start talking to you, you'll develop those relationships. Then when you do have your study that comes out, and maybe you can't write about it directly because it's, it's a conflict, or it's hard to kind of write about your own work and get that published, but you can contact those journalists and say, hey, remember I reached out to you last year, and or you reached out to me last year, we talked about blah, blah, blah. Well, I have a new study, you know, it makes it much easier. So I think any one of us can start writing in our field at any time and maybe never talk about our own work because of the background we have.
Great, thank you.
All right, let's do one more. Who was the other one who got their hand up?
Jacob said he didn't mean to have
Oh,
his raised. I
okay,
think, right?
that's fine. All right, we have more opportunity for questions. So I'm gonna move on and get to writing. So lots of ways to disseminate research. And I'm going to focus on writing, and in particular writing columns. So those are usually like 800 word pieces, because that's what I do, not because it's the only way to do it. I'm going to talk about what I have expertise in. So the thing I like to start with, and I will start with, is that writing well, in fact, doing anything well, is hard. That's because we don't define something as very good unless it's at the top. And to get at the top, there's a lot of competition. You have to work hard. So this is true of writing, and it's sort of obvious. It's true of all kinds of writing. It's obvious, but many of us forget it. And I have some hypotheses why we forget it. But if you think about even writing research papers, which some of us are established academics, we write papers, we basically know how to do that. It's not super hard. I won't say it's easy, but it's not super hard. It's because we were trained to do that. It took years for us to get where we are today. In fact, literally everything we're good at, including like walking, you know, talking, we didn't know how to do those things at all when we were born, right? So everything we are good at took a lot of effort. And I kind of got this insight and a bunch of others from a book by Anders Ericsson, who is a scientist on expertise, you know, of how people get good at anything. And he wrote this book called Peak with journalist Robert Poole. It's a book I recommend. It's actually the 10,000 hours rule that Malcolm Gladwell popularized some years ago. That comes from this book. What Malcolm Gladwell didn't quite point out was that to become an expert at something, yes, you need to put in a lot of time, like 10,000 hours or so, but you have to put in the right kind of time. You have to train in the right way. You can't just like, you know, randomly do stuff in this area and expect, you know, a lot and expect to be good at it. So it takes practice in a certain way. And I'm going to talk about some techniques for practicing writing columns. A reason why it's hard for many people to get good at something new, like writing a column if they've never done it before, is easier to see if you think about something you have gotten good at, like a sport or an activity like cooking or a foreign language or a game of any kind. Think of something that you're pretty good at. I like to use the analogy of tennis. Not that I'm particularly good at tennis, but because it's easy to make this point. If you wanted to get good at tennis, well, you have to start somewhere. You'd walk on the court the first day, and you would start hitting the ball. Well, maybe you would even miss the ball. You'd miss the ball a lot. You'd hit the ball all over the place in the net, not in the court, over the fence. It would be pretty embarrassing. And you'd have some pretty immediate feedback about what you were doing wrong. Maybe you don't know how to correct it, but you could say like, okay, I'm missing the ball. That's obvious. Okay, when I hit the ball, it doesn't go into court. That's obvious. And this is embarrassing. The embarrassment is motivating to get better. And the recognizing something from the outcomes as needing to be corrected is sort of obvious. That helps us refine. The problem most of us face, this comes from Anders Ericsson, is that we reach a point in anything we do where eventually we're doing it well enough that we're not embarrassed anymore, and we can't even see what's wrong with it. So everybody, I shouldn't say everybody, many of us could get to some facility with tennis or some other activity where we're like, okay, I can sort of do this. I'm not embarrassed. I don't know how to get better. I don't know what to do. I would have to get an expert, pay for lessons, you know, work in a different way. That's what's hard. And the people who get really good at stuff, they are constantly figuring out or having it pointed out to them by other experts what it is they're doing wrong and how to correct it. Nobody is born awesome at something. So that's really important to know. So how do we practice writing? And I want to talk about, there's dozens of things about writing to practice, ways to practice, but I want to talk about 5 things I think are super important and I think you can understand. They're listed here and I'm going to go through each one. So the first thing to do is read and emulate. If you want to write in the something like a column for a paper or, you know, major media outlet, read that style of thing. Go get a bunch of columns and read them actively, by which I mean really study, deconstruct, you know, what is the form? What is the author doing? Particularly pay attention if you feel anything. Oh, I felt moved. I feel sad. I feel happy. I feel intrigued, curious, whatever. And then like go back a sentence or a paragraph and say like, how did the author make me feel that way? Or I think this is a common experience when we're reading something, sometimes some part of our mind clicks and it's like, how did he get to this point? How did she get to this thing? Why are we here from where we started? And we kind of, whenever you have those kind of questions, I advise you to go back and like see how is the chain of logic formed? Where did they make those transitions? I think that's the only way to start. Kind of get the style in your ear. I'll come back to that. The other thing I advocate is practicing every day, if possible. If totally not possible, at least a few times a week. But every day is better, in my opinion, even if it's a little bit. So 15 minutes, 3 sentences. You want to write a column, work on it a little bit every day. This is how I get myself to write anything or do anything when I'm feeling like I don't have time to do it, or it's never the high priority thing, but I have a deadline and I have to get it done. I do it first thing in the morning. When there's something that needs to be written that isn't getting written, I say, okay, I'm going to go into buckle down mode before I check email, before I read any news, before I eat breakfast, like almost before I leave my room. I do the thing. I spend the 15 minutes, the half an hour and on what I'm trying to write. And here's what it does for me. First of all, it makes me get through it. Because like after doing that for some weeks, the thing is done. Like the draft is done. The other thing it does for me, it's kind of like going to the gym, because once I've done my time in that morning, I let myself off the hook the rest of the day. I did it. Like it's bonus if I go back to it later in the day, but I feel like I did my 15 minutes on that column, or I did my half hour on that grant, you know, the proposal I needed to get to, or that paper, and I'm set for the day. I've done my work. Now I can do the other things and not feel guilty. It's not hanging over my head. So I recommend that, even if it's only a little bit. All right, so now I'm going to really get into the nitty gritty, and I want to go back. I'm going to focus on the lead of a piece. That's the first, usually paragraph or first few sentences of a piece. And the reason I'm going to focus on it is I think, well, I'm going to say more than I think. I know it's the most important part of a piece, of a column. And it's the most important for 2 reasons. One, it's the first thing, other than the headline, that anyone's going to read. So if you want to get them hooked on your piece, you got to have a good lead. And second is, it may not be the first thing you write, but it's the first thing you write. When you write it well, then you know what the heck it is you're doing in the rest of the piece. In my view, if you don't have a lead that's in the right direction of where you're going to go, you don't know what you're going to write for the rest of the piece. And when I work with people on their writing, I often, if they send me something more than the lead, like more of a fully formed draft, I often say we have to go back and work on the lead, which in my opinion is the first 3 sentences. I have a 3-sentence rule. Lead should be, you should be able to convey your lead in 3 sentences, because I can't work with someone on a whole piece until I know the lead. I really can't. I don't know what I'm doing with this whole bundle of sentences, the other 50 sentences in the piece or whatever it is. I don't know how to edit them if I don't know what the piece is about, and the lead has to tell you. So there was an exercise associated with this workshop, and the exercise was to go do a bunch of reading. So do that, hopefully kind of active reading, and look at the lead of other pieces, could be mine, could be others, and then try to write one. And when I do this as a workshop in person, often I have people do this in real time if we have enough time. But what I advocate is go ahead, write your lead, write 3 sentences, the beginning of the thing, the whole column you want to write, and then look at it and think about what you read, actual columns by other people that are published columns, and say, does my lead sound or seem like those leads stylistically? And at least get to the point where you can say, yes, it does, or no, it doesn't. And we're going to go through a bunch of examples later where I'll ask you questions about how is this not like a lead? How is this, and I think that's the first objective in trying to get better at writing, or get better at anything. I'll go back to tennis. It's the recognizing when what you produce is not what you want. It's the first step. Once you can say, like, this is not right, you may not be able to say why it's not right, but at least you can say it's not right. You can go get help and say, there's something wrong with this. Do you see what it is? But over time, you'll be able to say, like, oh, it's not right, and I know why. And I'm going to give you some other tips about how to figure out what's not right. But let me start with the lead. So here's a lead that I was sent in one of those exercises in previous versions of this, or some other time I gave this workshop. Somebody sent me this lead as part of the exercise that I gave them. I'm going to read it to you. Catheter-associated urinary tract infections, CAUTI, continue to prevail as a prominent patient safety problem associated with an increased rate of morbidity and mortality. Between 15% to 25% of hospitalized patients receive short-term indwelling urinary catheters. Not surprising, efforts to prevent CAUTIs in the United States, Canada, and Europe have intensified, focusing on multidimensional approaches, including the use of bundled interventions to reduce CAUTI rates. So here's the interactive part, and just shout it out because I'm not going to look. Does this seem like a lead that you would read in a newspaper? And if not, what about it doesn't seem like a lead?
Not for a
It's much too
layperson.
complicated.
Complicated. What was the other one? Much too?
Not for a layperson.
Yeah, so jargon.
Great for urologists, but that's not your audience.
Jargony, complicated. Anything else? No wrong answers. It's only your impression. Or any like signals of problems? Like without even reading it, if you just sit back and say, I can see there's going to be a problem here. What is it?
The words are long and the sentences are long.
Long sentences, long words. Yep. Anything else?
Abbreviations starting up top.
Yeah, acronyms. That's a big giveaway that it's probably not accessible. Any other ideas? No wrong answers, but I'll say, okay, I'm going to give a lot of rules. I've already given you some, like 3-sentence rules, stuff like that. All rules in writing and many things are sort of like they're fuzzy rules. Like, yeah, usually it's a rule, but occasionally you can break it. I usually question numbers in a lead. I'm not saying you never use a number in a lead. I'm saying when I see a number in a lead, I think I would go back and see, do I really need that number? And there's a reason. There's a reason, and I'll get to why. But all your answers were great, and I would just add that there's some numbers here and maybe shouldn't. So yeah, this is you could tell by how I've read this thing probably 15 times. I still can't read it smoothly. And that's another thing one can do is read one's own writing. And if it's hard for you to read, then there's probably a problem. I'm going to come back to this one. So first I want to show you a bunch of my leads. This is not necessarily for self-promotion, but it's because I know I can deconstruct my leads. So I'm going to read you a bunch of my leads, and then I want you to tell me things that you think about them, whatever your impressions are. Before they see a doctor, most patients turn to websites and smartphone apps. Caution is advised. Research shows they aren't very good. That's a lead I wrote. There's another one. Considering how much we already pay for healthcare, you have to wonder why doctors, hospitals, and insurance providers so often fail to coordinate their patients' care. For some of the most important drugs, prices may be too low. Your dentist has probably offered dental sealants for your child. Mine has. Without knowing whether they work, I've always accepted them. Turns out this was a good move. By the way, that's a 4-sentence lead, violating my 3-sentence rule, but proving my rule that not all rules are meant to be followed. Maybe the person working near you, the one who dragged himself to work and is now coughing and sneezing, couldn't afford to stay home. All right, so what are some characteristics of these that jump out at you? You should shout them out.
Short.
Okay, short, yes.
I think it's conversational.
Conversational. Can you say anything more about that?
Yeah, it feels like, so for example, the second and the fourth sentences is like you're making a conversation with me, like your dentist has probably offered something, and like you have to wonder, well, like what I'm just like seeing the use of the word you. It makes like it's more like relatable to me, and it draws my attention to read more about that.
Mm-hmm. Yeah, I'm going to come back to that in a second. But any other thoughts?
The writing is informal. You're using contractions in addition to the use of the you, so you're sort of breaking all of the formal writing rules.
Mm-hmm. Mm-hmm. I heard another. Yes. No, there was another person.
Yeah, I was just saying they read like you're speaking as opposed to writing.
Yeah. Yeah. These are great. And actually, some things you guys have said have not come up before. I don't think anybody said read like you're speaking or conversational, use those terms before when I've asked this question. Any other thoughts before I dig into these a little bit? I want to point something out.
There seems to be a conclusion or a point made that to get the reader interested in why you come to that point.
Yeah, that comment and one of the earlier ones, like connecting with the reader, combined to something about most of these. Well, I think it's obvious in most of these and arguably true of all of them. Turns out there's a formula actually to these, which I didn't know about. I was doing this for years and was only doing this workshop. The teachers in the audience who've taught a lot probably know this phenomenon where like you're teaching something and then you realize like, oh, now I know what I'm teaching. Like there's like a trick, to a shortcut almost. There's a formula to these. Is it clear to anyone or anyone have a hunch what the formula is? It works.
It seems like in all these you're saying you've probably had this experience, but what you think about this experience is wrong. And I'm going to now correct your preconceived notion about it.
Yeah, I'd say a special case of the overall formula. So I'll just jump into it. It's basically it, which is tell the reader something they probably agree with, and then tell them something they don't know about it, right? And I think it works. Once I discovered this formula, I was like, I'm never writing a lead differently. I almost can't escape it now. It's so, and it's not to say it's the only way to write a lead. Again, not all rules are meant to be followed at all times, but there's plenty of other ways to write a lead, anecdotal leads, and I don't even want to get into it. It's like my way of writing a lead is this, and it works so well, I probably can't get out of it. And I think it works because you get people nodding their heads and they're like, okay, I'm with you. Yeah, I check websites when I'm sick. Yeah, we do pay a lot for healthcare. Hey, I thought drugs were really expensive. Blah, blah. Like they're like, okay, I'm with you. And then you hit them with something a little bit counterintuitive, or like you tell them they're wrong in a way, or you say like, but maybe you haven't thought of it this way. And they're like, okay, now I want to read more, you know? So that's it. And that's all a lead should do, in my view, is get the reader to read more. In fact, that's all every sentence should do. Every sentence kind of should sell the next sentence. And that's it. That is it. Do those two things, get people on your side, and then get them interested, and you are out, your lead is done. And that's why the whole Caudy thing is not the lead. And however, there's lots of good content in this Caudy thing. Maybe not stylistically right, but there's what it shows is that the author knows a lot about this topic, has a lot to say. That's great. So I very rarely get a lead from someone that doesn't have some value in it for the purposes of the piece. I always say, like, you have something here. What you have is a lot of good content, but what you don't have is a lot of good form. And this is something very hard for academics to get over. It's something we have to get over when we want to write these kind of things, which is we have to stop thinking about content and start thinking about form. It is so hard for us. We want to talk about content all the time. Is what our brains have been trained to do, is content, content, content. Like, what is the fact? What's wrong with this fact? What are the nuances about this fact? Like, what are the pros and cons of this? And we are so good at that, we can't get out of our own way. But we also are so good at it, we actually don't need to, that's not our problem. We don't need to worry about it. So I've been in conversations about writing, like workshop situations where people start, like, if someone else knew about a couple people knew a lot about urinary tract infections, they start arguing about content. I'm like, whoa, stop it. Don't argue about the content here. Argue about how to make this more accessible. Argue about the form. I'll do more of this later in the, as the car talk guys used to say, the third half of the presentation. But here's my revision of that lead. Hospitals should heal, not harm. Yet hospital-acquired infections remain a common problem. The solution is within our grasp, but ... Now, I stopped this lead because here is where I would have to work with the author and say, let me help you finish this. Or the author might say, well, that's not what I want to say. It's like, fine, then we'll have a different lead. But here's the thing, the lead has to be short and simple like this. Needs to start from a place where everybody's nodding their head. Yeah, hospitals should heal, not harm. You got to get out of the weeds of Caudy's. You might want to elevate it to just general infections in the hospital. If you want to drill down into catheter, based infections, you can do that. For example, I gave this second paragraph, or maybe it'll be the third paragraph. There are several ways an infection can be acquired during hospital. One is from a catheter, right? So you can get to all the great details about Caudy's you want, but you can't do that at the top because it's not where people are. You need to meet people where they are. So it's all about form. It's very little about, I'm not arguing with the fact that this person has great content. Okay, so I will get back to leads later. I want to talk about simplification, and this will get at the numbers thing I talked about earlier. So let me read you something else I wrote. This is after, right? I gave you this lead at the bottom. Maybe the person working near you wants to drag himself to work, blah, blah, blah. Couldn't afford to stay home. Okay, that was a lead in an Upshot post. And then I think the next paragraph is this. Paid sick leave slows the spread of disease. Cities and states that require employers to offer paid sick leave have fewer cases of seasonal flu than other comparable cities and states. Flu rates would fall 5% if paid sick leave were universal. According to one estimate, an additional 7 million people contracted the H1N1 flu virus in 2009 because employees came to work while infected. The illness led to 1,500 additional deaths. So this is, I would argue, a fairly simple paragraph, but it has statistics in it. And there's a simple way to introduce statistics, and we're all probably going to want to use some numbers in our work, in our writing for lay audience, because that tends to be part and parcel of the research we do. you need to tell the readers what the numbers mean before you give them the numbers, because numbers by themselves don't convey a meaning. It's just a number. So if you just said 5%, you know, flu rates would have fallen 5% if paid sick leave were universal. The reader doesn't know if 5% is a lot or a little. You have to tell them. But it's a little cumbersome or a little, you know, not stylistically great to like say, and 5 is high, actually. You set them up for it. So I think the preceding sentences kind of get them ready to interpret the numbers you're going to give them. And that's true of the other numbers in this paragraph. And just to kind of bring home the point that you can tell a story with very simply, there's this famous example. Some mistakenly credit it to Hemingway, but it actually predates him and nobody knows who came up with this. For sale, baby shoes never worn. It's a story in 6 words. We're not going to tell the story of research, you know, in a certain area in 6 words, but I just give that to you because it just shows you how much you can convey in 6 words. I mean, this can kind of break your heart with 6 simple words. So you can tell a lot with a few simple words. The last idea I'm going to give you, and we're going to move on, is connect ideas. I actually am going to read the first 5 or so paragraphs of a piece, and then we're going to dissect it a little bit. A growing proportion of Medicare beneficiaries are opting out of the government-run insurance program. They're instead choosing a private plan alternative, one of the Medicare Advantage plans. The strength of this trend defies predictions from the Congressional Budget Office, and nobody can fully explain it. Here's another mystery. Traditional Medicare spending growth has slowed, bucking historical trends and expectations. Though there are theories, we don't fully know what's causing that either. Pinning down explanations for these 2 mysteries is important. Doing so could help us understand the structure and cost of Medicare in the future. Mysteries may be connected by something that appears at first to be unrelated. Doctors and hospitals tend to treat insured patients the same way, regardless of what kind of coverage they have. A traditional Medicare patient admitted to the hospital with, say, pneumonia will receive the same standard of care as a similar but privately insured pneumonia patient. From this, an idea emerges that links the 2 mysteries. The rest of the piece is about what that idea is. So the reason I wanted to read this to you is to illustrate something you can do in your own writing after you've written a draft, or maybe after you've even edited that draft for a while, is go through and just read what people call the topic sentences, or the first sentence of every paragraph. And if you just force yourself to read all those first sentences, you should see some kind of through line. There should be some kind of structure that is evident just from those sentences. I like to think of it as like the backbone. It's not the whole body, but it gives you like enough, or maybe it's the skeleton, enough to see what's going on, what the structure of this thing is. And it's something you can do with your own writing, just to see if it's there. And if you kind of don't see, if you sense like a disconnect, like you can't see how one leads to another, you should question that. Doesn't mean it's wrong, but you should see like, is the reader really going to follow from this point to that point? Because, you know, and maybe they can with the connective tissue, but maybe you have something to work on. The other thing to look for in terms of connective tissue is kind of repeated idea. And it's in here too, this idea of mystery, or something that defies predictions, or we can't explain it and we don't know. That's over and over and over again. I think that really helps stay connected, kind of stay focused. A lot of writing we do when we get out of our comfort zone, like what helps us stay focused in our academic papers is we know the structure. We know, like, you know, intro and data and methods and results and conclusions. Like, that helps us. When we get to a new area, a new kind of writing, it feels unstructured and we're out of balance. And you can go to your own writing and say, like, am I staying like on one point? And a lot of people who write columns who don't have a lot of practice with it, they're just going all over the place. And so I point this out because what I've done here with this sort of underlining and diagramming in a way is not something that I would expect myself or anyone to do when they write a first draft. What I'm suggesting to you is that after you've written go back and look at your writing for these things. And that looking for these things and not finding them or not finding them as thoroughly as you would hope will help you in revising your work. So this is just a summary. We're getting to the end of the second part. When you don't know what else to do when you're writing, I'll give you some things to do. You know, you're sitting there with a draft and you're like, I don't know if this is good. I don't feel comfortable with it. What should I do? Go find something to read and emulate, and then compare, just stylistically. Like, does this sound like that? Look at the lead, compare it to other leads, try to sharpen it, try to make it, you know, just work on it. You can be like a robot and look at every sentence and every word and ask yourself, can this be simpler and shorter? Do I need it? Like literally forget anything about everything and just like go sentence by like, could I make this shorter? Oh yeah, I could cut this word, or I could rearrange and lose 3 words, or how about this word? Could this be a simpler word? Like you could just do that and it will get better. And then try to look for connected ideas through the topic sentences and through some kind of repeated idea that kind of pulls the reader through the piece. This is just a start. This was about half an hour, right? It's not going to turn anybody into an expert writer. There's lots of other ideas out there. Here's a bunch that people tweeted at me when I asked for suggestions. We talked about some of them. There's dozens of others. There's lots of other resources. So I have resources on my blog, and the tiny URL right there at the top, if you go to that, it'll go to all these resources that are listed on the rest of this slide. I tried to pick a tiny URL that's memorable. A press release is not enough, APRINE. And then I had to add 1, 2, 3, because I guess someone had used A prime before. But you can hopefully remember that or jot it down really quickly. You'll find a paper in HSR with me and colleagues about academics writing for mass media that covers a lot of like meta topics, some of which have come up and will probably come up in our conversation. Some videos, an example of how I write in 4 parts that kind of goes through some nitty gritty on writing, some of which I've covered, some of which I haven't. There's other resources for writing, one at the New York Times, there's an op-ed project, and there's no doubt lots of other stuff, but this is just one set of resources. I'm just going to wrap up with the marketing thing. So if you've written something, you wrote a blog post and it's published, you wrote a column and that's published, you wrote a fact sheet, a policy brief, whatever, actually it could be an academic paper, to be honest with you. What do? You can still, there's more you can do. So what I advocate doing, and I have done a lot of, is emailing. Good old-fashioned email. Email as many journalists you think would be interested as possible. Try to get their email addresses. You often can. And I would use the email, I do use the same 3-sentence rule in my emails to journalists as I do in my leads. I also, I make sure I write a subject line that will get them to open the email. That's the purpose of a subject line. It's to get them to open the email. Many people will not open emails because they have too many and they're too busy, and journalists will not open your email unless the subject line is, you know, makes them want to. And then a really simple 3-sentence email with a link to your thing. If it's a paper, I think you can do this with a paper in an academic journal, but you might need to say, I can provide the PDF if you wish, just ask. Better if you've written a plain language summary of the paper, and that's over here at this blog post, and you can point them to that. But if it's evidence about something in the news that journalists would want to write about, it's fair game. So here's an example. Back when raising the Medicare age was being debated in 2013, raising the Medicare age now saves even less. We judged it the wrong way to reform Medicare before. The CBO just re-estimated the federal savings and they're dramatically lower. Parentheses, they had made a mistake in an earlier estimate. So it's an even worse way to reform Medicare now. That's 2 sentences. Details here. Quick, out. Another example, the Oregon Medicaid study does not say Medicaid is a failure. Lots of people were interpreting it that way. New study of Oregon's RCT of Medicaid finds mixed results. Mixed does not mean failure, and far from it. Aaron Cow and I break it down in a new post. Link, done. Here's another example. I'm not going to read it. This was on a particular thing about healthcare.gov. We had 3 posts in one day, so we just 1, 2, 3. Here's each one in one sentence. The reason I advocate 3 sentences is because journalists are inundated with walls of text from PR firms, and I get them too because I'm viewed as a journalist for my New York Times writing. They don't read them. They're not useful. They're absolutely terrible. You can include more than 3 sentences in an email if it's the only way to get the information, but the lead should be 3 sentences. And then I would just say more below. And I usually put 3 asterisks and put all the details below. That way people know up top what it's about. I think in the interest of time, I won't say more about this, but there's other things I could say about emails. The main life lesson is long emails are terrible and you shouldn't write them in general. All right, so big picture, very hard to get people to read journal articles, but if you simplify it for them, it will help. Let's pause for questions. What comes after this is let me just preview a bunch of examples and more leads. And, I've broken them up by like thematically kind of what's problem with them. And it's just a bunch of examples. And I think it's worth doing some of that, but I want to give time for questions. So I'll pause here. Any comments or questions before we go on? Let's see. No hands are up. Okay.
Austin, it's Nicole. I have a question.
Go ahead.
So one thing that I have found tricky is you write an op-ed and you try to place it and it's hot, but someone else got out in front of you a couple of weeks before on something that's really hot. And I have a hard time figuring out how early is the right amount of lead time with the big papers to place an op-ed. Does that make sense? Like, is it a 2-week lead time? Like, what do you think is appropriate? Because sometimes you don't know what's going to happen until, the Supreme Court decides something, or do you know what I'm saying?
Yeah. And nobody loves being in the situation of like, okay, now I'm going to stay up all night and write this thing.
Right.
Even though, yes, you could do it, but it's very disruptive. The best way, but a very hard way, is to already have the relationship with the editors such that like you can kind of pitch the idea. This is very, very hard, but if you can do it, you have a relationship with editors at some place and you say, it looks like the Supreme Court is going to come out with a decision on, or we know they're going to come out with a decision on X, this year, this season, whatever, the next few months. I'd love to write a column on it. Here's the basic gist of it. If it comes out this way, here's the gist if it comes out that way. Something for them to go on. If they can say, yes, we'd love to have you, like get it to us as soon as you can. Then when it comes out, you can jump in and say, I'm going to write this thing for you, remember? And then of course you want to get it to them pretty quickly, but you probably don't have to get to them overnight. Now that presumes you have that relationship. If you don't, you're at the mercy of the market. The faster, the better. But otherwise, often there is, even though someone else may have beaten you at your preferred outlet, maybe it hasn't been written at a different outlet. And even though you might be making a very similar point in your piece as has been published, say it's been published in the New York Times, but like Washington Post hasn't done it, or Stat News hasn't done it, or whatever. You can probably go to those other places with the piece, and they're not going to care that much, or even know that someone else has written the same idea somewhere else, because if they think it's going to attract eyeballs and be of interest to their readers, they want it. So I would just say, like, just go somewhere else. I think that's.
May I ask a follow-up to that, which is how quickly do you move on, right? Because you want to give them time to read it and respond. 24 hours, 48 hours. I mean, you lose your window of sort of hot time. You know?
If it's really hot, I mean, this is a really hard question, right? Because you never know if I'd given them one more day, they would have gotten to it and would have gotten in. But if it's super hot, you just don't want to be waiting. And usually I I give them the deadline in the email. I say, like, I can give you this for the next day, 2 days, and then I'm going to move on. You know, and often if you've moved on, but they come back 2-3 days later and say, oh, we actually want it, you know, if no one else has grabbed it, you know, you can still probably do it for them. But I try to give them a deadline. By and large, I personally try not to write things that like are that time sensitive. But if you're in that position, you have to give them a deadline. Otherwise, you're just waiting. Some places have their own deadline. I think the Times says, like, if you don't hear back in 5 days or 7 days or whatever, 5 business days, like, assume it's a no, and like that's just their timing. If you can give them more time, I wouldn't give places more than 2 weeks is even too much. I'd say like a good week. You know, if it's late in the week, I'd say like the end of the following week. But basically, they should be able to decide quickly. That's my opinion.
Thanks, that's helpful.
This is an informed opinion. It may not be right. I'm going to move on, but people should just jump in. So I want to go to common problems and solutions. And we start with this diagram, which actually I got from the music world, in particular trumpet playing. I play the trumpet, something I'm trying to get better at. And this is popularized by some professional trumpet players, but maybe it showed up in other contexts. And the idea is that, and I kind of alluded to this earlier, when we're trying to do something hard, that's represented by that X in the upper right, way out there. And we can't really do it in the space that we're working in. So with writing, there's a core of that activity we have already mastered. You know, in writing, you know, we're all English speakers, you know, English writers. We can write sentences, we can write paragraphs, you know, we can read. Like, there's things about writing that we have mastered. And then there's things we've almost mastered and things we can sort of do, and then there's things we can't do. And what I see a lot of people doing when they come to me is they're trying to do that really super hard thing that's the X, which is like, I want to write a column and I'd love to place it at the Washington Post, they say. And then they send me their column, their draft. And I say, I look at it, I say, okay, have you ever written one before? No, but I know a lot about the research. Well, that's clear for you. You know, have you read any columns before? Yeah, you know, time to time, like, okay. Basically what you're trying to do, I convey to them, if they're willing to talk to me, is you know how to jog and you're trying to run a marathon tomorrow. Like you go for like 3-mile jogs and now you want to run a marathon tomorrow. That's not going to happen. It's not going to happen. This is very hard for people to appreciate and they don't want to hear it, but it's not going to happen. Now, it could happen if like they want to co-author with someone who has run marathons before and can play, you know, can get into a place like that. Or if they have a very sympathetic editor, and I'm not willing to do this, but some people might, who like wants to take their idea, edit it to make it readable for a place like Washington Post, but not take any credit for it. But that's not their own work. So what I advocate is growing that sphere, that circle of mastery, little by little over time by practice in the right way. You can eventually get to a place where you can write something in the style of a Washington Post article. Now you still, or column, you still may not get into the Washington Post. It's super hard. It's like, you know, getting into Harvard. It's like getting into New England Journal of Medicine. A lot of really good applicants, a lot of really good papers don't get in. Same is true of the Washington Post, New York Times, everywhere you can think of. You know, basically get ready to collect a lot of rejections. It's normal. But that it's really one of the things I'm saying over and over again is like, you can't go from what you know to what you want without practice. You just can't. So I wanted to make that super clear. So let's look at some common mistakes and what to do with them. So 3 sentences. I might not read all of these. maybe you should just trust me. This is not 3 sentences. I'm looking how many periods are in here. 1, 2, 3, 4, 5. This is 5 sentences. Okay. There's other problems with this. I'm not even reading it to you. You can see acronyms, AC, I don't know what that is. You can see numbers. If you just scan your eyes, you might see some jargon. Without reading that, here's my quick thing. We know how to prevent deaths from heat, yet too many Americans die when the temperature soars. 2 sentences. That's what this is about. A lot of great content. It should all come later. So 3 sentences. That's my first problem. If you write something like that, try to get it to 3 or fewer. Here's another one. The cultivation of learning strategies to increase educational outcomes may be the greatest missed event in our history of education. In fact, how someone is taught to learn can be as important as what they learn, and may change the stage for lifelong learning. Studies have been conducted on individual learning styles such as visual learners, auditory learner, and kinesthetic learners, VARC, by educational theorist Neil Fleming, 2019, so on. I should have said, these are all leads from previous workshops. How someone is taught can be just as important as what they learn. Failure to recognize this may be the greatest mistake we make in education. So there's just too many, among other things, there's too many sentences in this lead and it needs to be shorter. A lead and a whole column has to be more than facts. So here's a lead someone sent me. The US has the most expensive healthcare system in the world. Each year, over $3.5 trillion are spent on healthcare. Yet almost 30 million people don't even have health insurance, period. Okay, these are all facts. They're all true. There's no point here. A lead and a column has to be more than facts. So something like, despite spending more than any other nation on earth for healthcare, tens of millions of Americans are uninsured. There's a simple fix that won't cost more. I put that thing in brackets in gray because I don't know what the point is. I don't know what this author wants to make. I don't know what their point is. But if they sent this to me as a whole column and I read this as a lead, I'd say, stop, let's talk. What's your point? Your lead has to have a point. Maybe there's a simple fix that won't cost more. So say that if that's what it is. Maybe that's not it. But whatever it is, it's got to be there as that second or third sentence of the lead. Start with something familiar, which I mentioned before. This is a lead I received that gets into racial and ethnic data in Medicaid and the problems with that. It doesn't start simply. So my suggestion was, it seems like every form we fill requests our race and ethnicity. When it comes to the nation's largest healthcare program, there's a big problem. Bad race and ethnicity data is leading to bad decisions. Or maybe the data are leading to bad decisions if you insist on data being plural. So this starts with something familiar. We can all probably relate to having to fill out or having our race and ethnicity requested when we fill out forms. So start with something familiar. Here's another example. You guys should jump in anytime with questions. The current federal minimum wage is inadequate. The original federal minimum wage bill was created to provide able-bodied workers with a living wage. However, $7.25 an hour in 2021 represents a failure to achieve the initial goals of the bill. Right? It's fine. It's just, I think, could be more accessible. Imagine making ends meet if you hadn't received a raise in over a decade. That's the bind federal minimum wage policy has placed people in, failing families and the goals of the program. So, I mean, I made it accessible. I did a bunch of things. In all of these, I'm doing a bunch of things. I'm shortening, simplifying, taking out numbers, making the first sentence accessible. Let's just skip that example. Minimize numbers. So this has numbers in it. I created a version that doesn't have any numbers. In large part, America's substance use problem is self-inflicted. We're not investing in providing the treatments that can help address it. Like I said, it's not bad to have a number. Maybe it's fine, but I try to avoid them in the first paragraph. This is very numbersy. And the other thing I try to avoid is questions. If I find myself writing a question in the lead, I try to rewrite it without it. Again, it's not to say you can't have a lead with questions. I just think it tends to waste space on asking a question that you then answer rather than just answering the question. So let me just read this one. One of the most significant issues plaguing the provision of healthcare to incarcerated individuals in the United States is a policy called the Medicaid inmate exclusion. Did you know that despite a high proportion of individuals in the justice system being eligible for Medicaid, they're instead actively barred from accessing this coverage and the treatment it could cover? This policy has serious consequences as it isolates the correctional healthcare system from mainstream medicine and contributes to a lack of access to evidence-based care for individuals in the justice system. So I think you could just take that question out and you almost have the lead with a bunch of other simplifications. Imprisonment for crime usually ends, but many prisoners also lose access to healthcare too, which can cause lifetime harm. I mean, I went a little bit beyond what this person wrote. I brought in the point, like imprisonment usually ends, but then healthcare issue could be lifetime to like, so I did go a little beyond this, but I think there's a way to interest the reader in this topic without asking a rhetorical question. Simplify to grab attention. I think you've seen this in previous ones. You know, usually I read these, but I'm just trying to go a little quickly. President Joe Biden has a bold plan with bipartisan support to rebuild the economic security for many seniors, but it misses the mark. This person misses the mark at the end of their lead, but it was in a question, so I took the question out. And I'm just in all these, I'm simplifying, and I think it grabs attention more quickly. I'm not reading them to you because I don't have time, but in recent years, healthcare records have moved from paper to computer. While digital access could improve healthcare, there's a big flaw. Some doctors' systems don't talk to others. You know, I took out the acronym. I just made it simpler. So I think I'll wrap up because we're about at time. Sometimes you can do a one sentence lead. Too many juveniles enter the criminal legal system. I think that's a fine lead, to be honest with you. I think you can do it in one sentence.